It's probably been a couple of years since we did an interview on the totally subcutaneous defibrillator. So I guess it's no surprise that we now have 2-year results from a pooled analysis of the IDE study and effortless registry, and it is in the April 28th issue of JACC. I am with Bradley Knight, MD, Distinguished Professor of Cardiology at Northwestern University in Chicago. First off, talk about the technology. I mean, we've been studying it now for a while. What is it we're talking about when you talk about a subcutaneous defibrillator?
Well, a totally subcutaneous implantable defibrillator. It's FDA approved now in the United States. It's an option for defibrillator therapy for patients who do not need pacing or cardiac resynchronization pacing. It's a great alternative to a single chamber transvenous ICD system. There's pros and cons of each, but it is implanted totally subcutaneously.
Were you early on in the studies of these things?
We were involved in the IDE study that led to approval by the FDA.
So you're taking the IDE study and effortless?
Yes. So,
how many patients are involved and who are these people? Describe them.
Well, this was an unusual opportunity to take 2 large cohorts of patients and pool them together. So the IDE trial had 330 patients enrolled, and the effortless registry, which is largely European, added the remainder patients to 881 total patients for a 2-year follow-up.
What did you find?
Well, the patients were pretty representative of patients who get an implantable defibrillator. There was a tendency toward more younger patients who tend to come to us for this as an alternative to a transvenous system. We found evidence that supported kind of the IDE findings, which were relatively low complication rates and good effectiveness at the time of implantation.
So are you pretty optimistic about this technology at this point?
Yes, we've put in now 58 sub-Q ICDs at our center. We've had a very good experience. We've only had 1 device that had to be removed for an erosion. The data from the pooled effortless IDE registry are consistent with that. The likelihood of needing to have the device removed for infection or erosion was about 2.3%. The main issue related to complications were inappropriate therapies, both for SVTs and T-wave oversensing, which is being addressed by changes in the way we do programming with dual zone programming and software improvements to avoid T-wave oversensing.
How about patients? What do they say about this? Is it comfortable? Do they notice that it's even there?
Well, it's a bigger device. The current device is 69 cc's, and it's an 80 joule device, so it's about twice the power and more than twice the size of a standard ICD. It's put into a different location down here in the mid or posterior axillary line. Most patients tolerate it very well. I think the patients who are on the borderline size-wise are the ones that tend to have some persistent discomfort in this location, but surprisingly well tolerated given how large it is in that position. Women tend to come to us for this device to avoid scars up here in the upper chest area, and it seems to give a very good cosmetic result.
So what's the bottom line message in terms of what have we learned with this now for future patients?
Well, I think it's we talk a lot about risk stratification and who should get a defibrillator and who should be treated with ICD therapy, but this is the first time we really have a new development in the therapy itself. This is a great alternative to a transvenous system. I particularly offer this to young patients who are going to have leads that would otherwise be inside the heart for many years to avoid the long-term morbidity associated with lead problems.
Well, you can check out the data in this particular paper, which is in JACC. It's the April 28th issue, and it's 2-year results from the pooled analysis on a totally subcutaneous implantable defibrillator from ACC 15. I'm Rick McGuire.